All right, let's talk about the lab values you absolutely positively need to know for the NCLEX and, for your entire nursing career. In this explainer, we're going to demystify these crucial numbers because they're not just numbers. They're actually telling a story about your patients.
And yeah, I totally get it. Seeing a big wall of numbers on an exam can be super intimidating. But we're going to tackle that feeling head on. Because, understanding these values isn't just about passing a test. It's really about learning the language your patients' bodies are speaking so you know exactly what to do for them.
So, the good news is the NCLEX really focuses on a few key panels. Think of these as the workhorses of hospital medicine. We're going to cover the complete blood count, or CBC, which looks at things like infection and oxygenation. We'll dive into metabolic panels to check on electrolytes and how organs are doing. And, of course, coagulation levels to see how risky bleeding is. Then we'll hit arterial blood gases, lipids, and some key drug levels. Every single one tells a vital piece of the story.
Okay, let's jump right in with our first key area. We're going to start with the very building blocks of our blood. The cells that are absolutely essential for life, and just as important, our ability to stop bleeding.
Here they are, the foundational numbers. I like to think of these as your body's internal team. Your white blood cells, they're your infection fighters. The red blood cells are the delivery guys carrying oxygen. And your platelets, they're the first responders for any kind of clotting. Just getting comfortable with these ranges is a huge first step to mastering the CBC. Now, these terms are so much more than just vocabulary words for a test. They're clinical shorthand. When you hear a nurse say a patient has thrombocytopenia, your brain should immediately go, okay, low platelets, risk for bleeding. Same thing for leukopenia. That should instantly make you think high risk for infection. And here's a super important point. Not all ranges are one size fits all. For hemoglobin and hematocrit, which basically measure how much oxygen your red blood cells can carry, the normal ranges are different from male and female patients. You can bet the NCLEX will expect you to know that difference. So, when you have a patient on a blood thinner, you're not just giving a medication and walking away. Oh no, you are constantly monitoring its effect. This is where these two key tests come into play. You're going to use the PT/INR for a patient on warfarin and the APT to keep an eye on a patient with a heparin drip. It's how you know if the drug is actually working right. And this is the target we're aiming for. See, we don't want the normal value anymore. We want the therapeutic value. For an INR, that sweet spot is usually between 2 and 3. If it dips below 2, the warfarin isn't doing enough. If it gets way higher than 3, your patient is at a major risk for bleeding. It's the exact same logic for the APTT on heparin. All right, let's switch gears from blood cells over to the body's chemistry. This is where we check on everything from a patient's hydration status to how well their major organs are doing their jobs. The basic metabolic panel, or BMP, it gives us this incredible snapshot of what's going on inside. These electrolytes, they're fundamental for just about everything. Nerve signals, muscle contractions, they're basically the spark plugs for almost every function in the body. Now, if you're gonna focus on memorizing just one electrolyte, please make it potassium. Pay really close attention here, because even tiny little changes outside this super narrow range of 3.5 to 5.0 can have major, life-threatening effects on the heart's rhythm. It's a big deal.
Okay, now for the organ report card. Think of BUN and creatinine as the grade for the kidneys. If these waste products are piling up in the blood, it tells you the kidneys aren't filtering like they should be. For the liver, we're looking at enzymes like ALT and AST. If the liver is damaged, these guys leak out into the blood, and their levels go up. And finally, bilirubin clues us in to how well the liver is cleaning out old red blood cells.
All right, on to a few more specialized tests. But don't let that word fool you. These are just as vital, and you're for sure going to see them on the NCLEX and in your practice. They give us some really deep insights into a person's metabolic and respiratory health. ABGs are all about one thing, acid-base balance. So here's the trick. You got to remember the odd one out, and that's PaCO2. For pH and bicarb, a low number means more acidic. But for CO2, which is an acid that we breathe out, a higher number means more acidic. It's the complete reverse, and getting that down is absolutely key.
The lipid panel. Here's a super simple way to remember this forever. The L in LDL stands for lousy, so you want that number to be low. The H in HDL stands for healthy or happy, so you want that number high. It's honestly a perfect little mental shortcut for test day.
The hemoglobin A1C is brilliant. It gives us the big picture of blood sugar control over time. A daily glucose check is just a single snapshot, but the A1C, that's like the highlight reel for the last 3 months. For a patient with diabetes, our goal is to keep this number under 7% to help prevent all those long-term complications. And finally, for a lot of common meds like these, there's a really, really narrow window between a dose that works and a dose that's toxic. Knowing these specific levels is non-negotiable for patient safety because you're going to be the one checking them right before you give the next dose.
Whew, okay, I know, that was a lot of numbers. But now let's talk strategy. What is the single most important thing to remember when one of these lab value questions pops up on your exam screen?
I want you to burn this into your brain. The NCLEX is not designed to trick you. It is not going to give you some borderline value like a potassium of 5.1 and make you stress out and guess. Nope. When a value is wrong on this test, it will be obviously, significantly, screamingly out of range. And you know why? It's because different hospitals, different labs, different textbooks, they all have slightly different normal ranges. The NCLEX knows that, so you can walk into that test feeling confident that when you see an abnormal lab, it's going to be so clearly wrong that it points you right to the correct nursing action. So with this whole framework and that key strategy in your back pocket, you are ready. The goal isn't to just memorize a bunch of numbers. It's to learn the stories they tell. Now go tackle your studies and you're going to walk into that exam and absolutely crush it.